Top 25 Lifeguard Interview Questions and Answers. In this video, we will explore the top 25 lifeguard interview questions and their corresponding answers. These insights will help you prepare effectively, ensuring you make a strong impression during your interview. Whether you're a seasoned lifeguard or new to the field, understanding these questions is crucial. We aim to equip you with the knowledge needed to confidently tackle your upcoming interviews and stand out as a candidate. 1. Why do you want to work as a lifeguard? Being a lifeguard allows me to combine my passion for swimming with my commitment to ensuring the safety of others. I enjoy being part of a team dedicated to preventing accidents and promoting water safety. This role also provides an opportunity for personal growth, as I can develop my leadership and communication skills. Helping people feel secure while they enjoy recreational activities is incredibly rewarding. I believe that my enthusiasm for water sports, along with my training, makes me a suitable candidate for this important position. 2. What previous experience do you have in lifeguarding or water safety? I have worked as a lifeguard at a local community pool for 2 summers, where I was responsible for monitoring swimmers, enforcing safety rules, and responding to emergencies. I have also volunteered at water safety workshops for children, teaching them about the importance of swimming skills and water awareness. Additionally, I completed a water safety instructor course, which provided me with advanced techniques for ensuring safety in aquatic environments. My experience has equipped me with the skills needed to assess situations quickly and take appropriate action when necessary. 3. Are you certified in CPR, first aid, and lifeguarding? If yes, which organization? Yes, I am certified in CPR, first aid, and lifeguarding. My certifications are obtained through the American Red Cross, which is recognized for its comprehensive training programs. The lifeguarding course included both theoretical knowledge and hands-on practice to ensure proficiency in water safety and rescue techniques. I maintain my certifications by participating in regular renewal courses, which keep me updated on best practices and any new guidelines or techniques in emergency response. 4. How often do you renew your lifeguard certification? Lifeguard certifications typically require renewal every 2 years. However, I prioritize staying current with all relevant training and often complete refresher courses annually. This practice helps me maintain my skills and ensure I'm up to date with the latest protocols and techniques in water safety and rescue. Regularly renewing my certification not only reinforces my knowledge but also enhances my confidence in emergency situations. Continuous education is crucial in this role, as it allows me to provide the best safety practices for swimmers and patrons alike. 5. Have you ever had to perform a rescue in a real-life situation? Describe it. During my time as a lifeguard, I encountered a situation where a young swimmer was struggling to stay afloat in deep water. I immediately noticed the distress signals, such as flailing arms and panic on the child's face. Without hesitation, I activated my rescue protocol, utilizing a flotation device to reach the swimmer quickly. Once I was close enough, I reassured the child and instructed them to hold onto the flotation device. After securing them, I safely guided both of us back to the edge of the pool, where we assessed their condition. The child was shaken but ultimately unharmed, and I provided comfort and support until they recovered. 6. What are the primary responsibilities of a lifeguard? A lifeguard's primary responsibilities include monitoring swimmers to ensure their safety, enforcing pool or beach rules, and providing immediate assistance in emergencies. They must remain vigilant at all times, scanning the water for signs of distress or unsafe behavior. Lifeguards are also responsible for maintaining a clean and safe environment, checking safety equipment, and performing rescues when necessary. Additionally, they must administer first aid and CPR as required, educate patrons about water safety, and report any incidents or hazards to their supervisors. 7. How do you maintain constant vigilance while on duty? Maintaining constant vigilance while on duty involves a combination of focus, discipline, and proactive measures. I regularly scan the entire area, using a systematic approach to ensure no spot is overlooked. Staying alert includes taking breaks when appropriate, while ensuring my replacement is informed and ready. I also engage with patrons, which helps me remain aware of their behavior and any potential issues. Utilizing tools like visual markers and maintaining a routine for checking in with fellow lifeguards ensures that I remain attentive and ready to respond promptly to any situation. 8. What steps would you take if you noticed a swimmer struggling in the water? If I noticed a swimmer struggling in the water, my first step would be to assess the situation quickly to determine the severity of the struggle. I would signal for assistance from fellow lifeguards while keeping my focus on the swimmer. If it appeared that the swimmer was in immediate danger, I would enter the water using a safe and effective rescue technique, such as a reach or throw rescue if possible. I would approach the swimmer calmly, encouraging them to relax while securing them with a flotation device if available. Once the swimmer was safely out of the water, I would provide necessary first aid and monitor their condition. 9. How do you recognize the signs of drowning? Drowning can occur silently and quickly, making it crucial for lifeguards to identify its signs. Some indicators include a swimmer's inability to stay afloat, flailing arms, and a lack of forward motion. Look for facial expressions that indicate panic, such as wide eyes or a mouth open for air. If a swimmer's head is low in the water, or if they are struggling to keep their mouth above water, these are serious warning signals. Additionally, a person may appear to be climbing an invisible ladder or may be submerged with occasional gasps for air. Being vigilant is essential for timely intervention. 10. What is the proper way to perform CPR on an adult versus a child? Performing CPR on an adult involves placing the heel of one hand on the center of the chest, with the other hand on top, and using your body weight to compress the chest downwards at a depth of about 2 inches. For a child, use one hand for chest compressions and compress to a depth of about 1.5 inches. In both cases, allow full chest recoil between compressions. The compression-ventilation ratio remains 30:2 for adults and children, but for infants, it's 30:2 with one rescuer or 15:2 with 2 rescuers. Always call for emergency help immediately. 11. How would you handle a spinal injury in the water? In case of a suspected spinal injury, my first priority would be to ensure the safety of the injured person while preventing further harm. I would carefully approach the individual and stabilize their head and neck to avoid movement. Using a rescue tube or spinal board, I would assist them without lifting them out of the water until emergency medical services arrive. It's crucial to keep communication open, reassuring the individual while gathering information about their condition. Ensuring that bystanders remain at a safe distance will help manage the situation effectively, allowing me to focus on the injured party's needs. 12. What safety equipment should always be available at a pool, beach? At a pool or beach, essential safety equipment includes life rings, rescue tubes, and reaching poles for quick rescues. A first aid kit stocked with necessary supplies like bandages, antiseptics, and emergency medications is crucial. Additionally, having a spine board and a defibrillator ensures preparedness for serious injuries or cardiac emergencies. Visibility aids such as buoy markers and flags indicating water conditions are also important. Regular checks and maintenance of this equipment help ensure readiness and safety for all patrons. 13. How do you enforce pool rules without causing conflict? Enforcing pool rules requires a balance of authority and diplomacy. First, I would approach the individual calmly and politely explain the rule they are violating. Using a friendly tone helps to prevent defensiveness. I would emphasize the importance of safety for everyone involved, making sure they understand that rules are in place for their protection. If the situation escalates, I would involve a supervisor or another lifeguard to provide additional support. Keeping communication open and respectful helps in diffusing tension while maintaining a safe environment. 14. A child is running near the pool and slips. What do you do? In this situation, my immediate priority would be ensuring the child's safety. I would quickly approach the child to assess any injuries while keeping the area secure to prevent further accidents. After confirming that the child is not seriously hurt, I would reassure them and check if they need medical attention. I would then remind the child about the importance of walking near the pool to prevent future slips. Additionally, I would report the incident to my supervisor to ensure that any necessary safety measures are reinforced and that all pool rules are communicated clearly to prevent similar incidents. 15. A swimmer is panicking but refuses your help. How do you respond? When faced with a panicking swimmer who refuses help, it's essential to remain calm and composed. First, I would try to communicate with them from a safe distance, using a reassuring tone to help them feel more at ease. I would encourage them to float or tread water while I assess their situation. If they continue to refuse assistance, I would maintain a watchful eye to ensure their safety while alerting other lifeguards if necessary. My priority would be to ensure they remain safe until they either calm down or I can safely intervene without escalating the situation. 16. You see 2 swimmers arguing aggressively. How do you handle it? In such a situation, I would approach the swimmers calmly and assertively, ensuring my presence is known without escalating tensions. I would first separate them physically to prevent any potential confrontation. Then, I would ask each swimmer to share their side of the story, listening actively to both perspectives. It's essential to remain neutral and not take sides. After understanding the situation, I would remind them of the pool rules regarding behavior and encourage them to resolve their differences peacefully. If necessary, I would involve a supervisor or additional staff for support. 17. A patron is intoxicated and trying to enter the pool. What actions do you take? If a patron appears intoxicated and is attempting to enter the pool, my first action would be to approach them calmly and respectfully. I would explain the potential dangers of swimming while intoxicated, emphasizing the need for their safety and the safety of others. If they insist on entering, I would intervene more firmly, reiterating that pool rules prohibit intoxicated individuals from swimming. If necessary, I would involve a supervisor or security personnel to help manage the situation and ensure the patron does not enter the water. Keeping communication clear and supportive is crucial in these scenarios. 18. Multiple emergencies happen at once, for example, a drowning and a bleeding injury. How do you prioritize? In a situation with multiple emergencies, my first step would be to assess the severity of each incident quickly. The drowning victim would take priority, as time is critical for their survival. I would signal for help from other lifeguards or emergency personnel while initiating a rescue. Once the drowning situation is under control, I would shift my focus to the bleeding injury, ensuring that basic first aid is applied to stabilize the individual. Clear communication with any available team members is essential to coordinate an effective response to both emergencies. 19. If you suspect someone is having a heart attack, what steps do you take? If someone is suspected of having a heart attack, the first step is to call for emergency medical services immediately. While waiting for help, I would have the person sit or lie down in a comfortable position to reduce strain on the heart. It's important to keep them calm and reassure them. If they are conscious and not allergic, I would provide aspirin to help thin the blood unless contraindicated. Monitoring their condition is critical. I would check for any changes in their awareness or breathing. If they lose consciousness, I would perform CPR and use an AED if available. 20. How do you stay focused during long shifts with minimal activity? Staying focused during long shifts with minimal activity requires a combination of mental and physical strategies. I set personal goals for each shift, such as practicing surveillance techniques or reviewing emergency procedures. Regularly shifting my position helps maintain alertness, as does engaging in brief stretches to keep my body active. I also use mental exercises, like visualizing potential scenarios that could arise. Staying hydrated and taking short breaks, when possible, allows me to recharge. Additionally, maintaining open communication with fellow lifeguards fosters a supportive environment and keeps everyone vigilant. 21. How would you handle a patron who complains about your enforcement of rules? When addressing a patron's complaint about rule enforcement, I would first listen actively and calmly to their concerns. It's important to validate their feelings and ensure they feel heard. After acknowledging their perspective, I would explain the reasoning behind the rules and why they are in place for everyone's safety. I would remain professional, offering to discuss the matter further if needed, and reassure them that my primary goal is to maintain a safe environment. If the situation escalates, I would seek assistance from a supervisor to mediate. 22. Describe a time you worked as part of a team in a high-pressure situation. During a summer camp, our team faced a situation when a child struggled in the deep end. As the lifeguard on duty, I immediately called for backup while keeping my focus on the child. My colleagues quickly responded, with one preparing rescue equipment while another reassured the other swimmers to maintain safety. Together, we coordinated the rescue efficiently, with one team member diving in to assist. The child's safety was our priority, and we successfully brought them to the edge. This experience reinforced the importance of teamwork and communication in high-stress scenarios. 23. What qualities make a good lifeguard? A good lifeguard possesses several essential qualities. First, strong observational skills are crucial for spotting potential dangers quickly. Excellent communication skills allow them to relay safety information effectively and manage conflicts. They must also exhibit strong decision-making abilities, especially during emergencies, making quick, informed choices. Physical fitness is important for performing rescues, while a calm demeanor helps maintain control in stressful situations. Empathy ensures they connect with patrons, fostering a safe, friendly environment. Lastly, commitment to continuous learning keeps them updated on safety practices and techniques. 24. How do you handle stress during an emergency? Handling stress during an emergency requires a combination of preparation and mental resilience. I focus on my training and protocols, which guide my actions and reduce panic. Staying calm is essential. I take deep breaths to maintain clarity and make rational decisions. I prioritize tasks by assessing the situation quickly, determining immediate needs, and delegating responsibilities if others are present. Communication is vital, both with victims and any team members. Keeping a clear head allows me to execute rescue techniques effectively and provide reassurance to those involved, enhancing their trust in my ability to manage the crisis. 25. Why is good communication important for lifeguards? Good communication is essential for lifeguards as it helps maintain safety and ensures effective responses during emergencies. Clear instructions allow lifeguards to convey rules to patrons, preventing accidents and promoting a safe environment. In high-stress situations, lifeguards must quickly relay information to team members, ensuring coordinated responses. Additionally, effective communication fosters trust with patrons, making them more likely to follow safety guidelines. Strong verbal and nonverbal communication skills can also help in de-escalating conflicts and providing reassurance to distressed swimmers, enhancing overall safety on the premises. In preparing for a lifeguard interview, being familiar with potential questions and crafting thoughtful responses is essential for success. This guide has covered the top 25 lifeguard interview questions, including essential skills, emergency responses, and teamwork. By practicing your answers, you can boost your confidence and demonstrate your commitment to safety and responsibility. Remember, a great lifeguard not only protects lives but also provides peace of mind to swimmers and their families. If you found this video helpful, please like and subscribe for more valuable content and tips to help you excel in your lifeguard career. Thank you for watching.